The government and insurance companies are very misleading when it comes to when you should join Medicare. When my dad approached 65, he got this letter in the mail. You probably had the same thing. And it's a scary letter from the government that says you must join Medicare at 65 or you may be penalized. But there's no extra detail about what that may means. And with more people working past 65, it's really important to know the details of what that rule looks like so that you join Medicare at the right time. Also, I had a client the other day who was joining me, and he told me that he had an insurance agent tell him that he had to be on Medicare at 65, even though he had an employer health insurance plan. That was definitely not the case for him. I'm glad that he raised his hand and asked more questions, because had he joined Medicare at 65, he would have easily wasted over $3,000 a year and created other long-term issues when it came to Medicare. So in this video, let's walk through what the rules say so you know the best time for you to join Medicare to both save yourself money, but to also have the best healthcare possible. So let's go ahead and jump into this. Medicare rules say by the time you're 65, you either need to be on Medicare or on an employer health insurance plan that meets Medicare rules. It can be your employer or a spouse's or partner's, but you have to have at least employer health insurance. So what does this mean? If you have, say, a marketplace plan, you are not able to delay Medicare past 65 without penalties. COBRA does not meet the rules either, nor do retiree benefits in most cases, or even veteran benefits. So we have to be sure that you have an employer health insurance plan that meets Medicare rules, and if you do so, then you can go to step 2. And the next step is, does the employer who provides the health insurance, do they have 20 employees or more? Now, if you're under 65 and you're disabled, it has to have 100 employees or more. But again, if your company has 10 employees, you can't stay on Medicare. You can't delay Medicare without penalties. You have to join Medicare at 65. If you don't join Medicare at 65, you're going to have not great health coverage, and you're also going to have penalties later on. And the third requirement is the prescription plan provided by the employer health insurance, is it deemed creditable? Now, creditable means the plan on average covers medications as well as or better than Medicare. Now, your company is legally required to confirm you this creditability every single year. So it's important to get that letter from your company and save that for your records. Once you eventually do join Medicare, whenever that might be, they're going to ask you for proof that you've had creditable prescription drug plans in order to avoid penalties. So by having this letter now, it will make your life easier in the future. So again, it is possible to delay Medicare past 65 as long as you meet all of these criteria. Now, here's the thing. Just because you can delay Medicare does not necessarily mean that you should delay Medicare. So we oftentimes see people who are trying to decide between their employer plan or Medicare. And we want to look at the details to confirm which is best for you. Look at the premiums and the deductibles and the copays and the medication costs and all of those things. I was helping out a client a few weeks ago who's working for a few more years, and her employer plan does meet Medicare rules, but she's not really sure what is best. Now, for her health insurance, she's paying around $500 a month for her plan, and her deductible is around $3,000, and her out-of-pocket is around $5,000. And she has health issues, so she's usually hitting those amounts. So based on her scenario, she can save a couple $1,000s every single year by being on Medicare versus being on your employer health insurance plan. So once you have that employer health insurance, or you've confirmed that your employer health insurance does meet Medicare rules, I recommend that you go one more step and confirm, are you best though staying on your employer plan? My usual recommendation is if you are paying more than $250 per month per person on your employer plan, and your maximum out-of-pocket is $2,000 or more on your employer plan, I highly recommend that you look to see the details of what Medicare will cost you. Because in most cases, if you're paying more than this, you're better off on Medicare. But if your employer plan is cheaper than this, you're usually best off staying on your employer plan. Now, there are a few more factors to this. If you have other family members on your employer health insurance, and your family members, if you leave your employer coverage, don't have other health insurance or have to find another source of health insurance, you might decide to pay a bit more on your employer plan to simply cover your family. However, again, do that research. I had a couple who delayed retirement for a while because they were scared of Medicare costs, and Medicare was always going to be cheaper for them. So don't assume anything, get clear on those details. So again, while this is a tipping point, other family members on your employer plan can impact it. Another thing it can impact it is your income. So Medicare looks at your income from 2 years ago to determine what you pay for Medicare now. So as of 2024, if your income was over $103,000 if you filed as an individual, or $206,000 filing as a couple, you will pay more for Medicare, as you can see on that right-hand column. So what does that mean for you? That means that if your income is higher, this tipping point will be higher as well, right? Maybe it's going to be $350 a month or $500 a month, but just know that your income can impact what the tipping point is for if you're better off on Medicare or on your employer health insurance plan, okay? So at this point, we've confirmed what the rules are. We've confirmed kind of the tipping point costs and the other factors to consider, whether it be other family members on your employer health insurance or even high incomes. So you should now be at a place, once we do extra research, to confirm, are you better off on Medicare or are you better off delaying your Medicare coverage and staying on your employer plan? Now, if you decide to stay on your employer health insurance plan, there's a few other things to consider. Number one is Social Security. If you are drawing Social Security 4 months before your 65th birthday month, you will be automatically enrolled in both Medicare Part A as well as Medicare Part B. Now, this can be a big red flag because if you're on Social Security and you're also on, say, a spouse's employer health insurance plan, you could end up unnecessarily double paying for your health insurance. And if you get by paying for both Part B and an employer plan, and you could also impact your Medigap open enrollment period as well. So if you're on an employer plan that meets Medicare rules and you know that it's cheaper than Medicare, you will likely want to watch out for the mail for your Medicare auto enrollment to come in, but then terminate your Medicare Part B as in boy coverage. Okay, that's most cases. We don't double paying for health insurance. If your employer plan meets Medicare rules, it will always be your primary health insurance until you leave Medicare. So while yes, you could pay money to have Medicare Part B as secondary, it doesn't do a whole lot. Now, I'm not as worried about you being on Medicare Part A because usually Medicare Part A is free. And number two, there could be implications if you're putting money into a health savings account. But if you don't have an HSA, then you can have Part A with no issues. Okay. Now, people to that point will ask me, right? But okay, Emily, I'm going to delay Medicare, but should I enroll in Medicare Part A anyway? And it goes back to my initial questions. Number one, does your employer plan meet Medicare rules? And number two, are you putting money into a health savings account? Okay. If you're not putting money into an HSA and you get that Medicare Part A for free through your 40 qualifying quarters, there's no harm in having Medicare Part A as well. Now, if you do have an HSA, you're putting money into an HSA, you need to be careful. Because if you're on Social Security, you're going to have Medicare Part A. But if you're not on Social Security and you have an HSA account, in most cases, our clients prefer to have the tax benefits of an HSA rather than having that free Part A. The rules say you could put money into an HSA up to the ladder of 65 or 6 months before you apply for Medicare. So again, your HSA is the main tipping point as to whether or not you enroll in Part A now or you wait until later. So once you're ready to join Medicare at say 68, what do you do? Now, there's a separate process to go through the application, but there's two kind of important things you have to do. Number one is understanding what paperwork is required to apply for Part A and or B, which is usually an online Medicare application. But number two, when you apply for that either A and or B later on, They're going to ask for your employee verification. They want to confirm that you've been on an employer health insurance plan since you were 65. So there's some extra paperwork required in order to get your Medicare benefits later on. Now, again, I want to keep a few things in mind. You can enroll in Medicare whenever you leave an employer health insurance plan. But be aware that your company could have specific rules as to when you can leave an employer plan. For example, most companies will allow you to leave the employer health insurance plan either for a qualifying event, which can be 65, or when you retire, or when you eventually hit an open enrollment period where your plan changes its annual cycle. It's usually around January 1st where plans change. So here's my point. When I have couples, and let's just say the older couple is a husband and the younger couple is a wife, if the husband is, say the husband wants to delay Medicare until his wife is 65, and say that his wife is 65 in June of whatever year. While his wife has a qualifying event in June to leave his employer health insurance, because again, she's 65, the husband can likely not leave that plan until the plan actually resets, which is usually January 1st. So my point is this. I don't want people to assume that they can leave their employer plan at any point in time, because there can be very specific rules as to when you can leave the employer health insurance plan. So please be aware of that, okay? So again, at 65, if you are not drawing Social Security, there is no paperwork to be done to delay your Medicare coverage. But at 65, if you are drawing Social Security, you will likely want to terminate your Medicare Part B drug coverage, okay? Now, if you're enrolling at, say, 68 or whenever you're ready, you're going to want to submit, as I mentioned, your Medicare Part B application, as well as your employment verification form. It's usually a pretty simple process if you know what to look for and you know what to follow, okay? But again, those are the important pieces of paperwork required to join Medicare later on. Now, there are common things that I want you to avoid when it comes to this process. I see people delaying Medicare even when their employer plan does not meet Medicare rules. This tends to happen with a company who has less than 20 employees, or when a company puts you on COBRA and the company says, oh, it's the exact same thing as your current employer health insurance. Well, COBRA is not the same once you're 65, so please beware of COBRA after that age. Number 2, I see people joining Medicare Part B too early, which results, as I mentioned, in overpaying for health insurance, as well as starting your 6-month Medigap open enrollment period too early. So again, the timing is important. I have seen people who, again, joined Part B too early, and it impacted which Medicare supplement plan, also called Medigap plan, we could get them later on. So get the timing right, but again, it can be confusing to delay Medicare. I know that my dad, he got this scary letter that says you must join Medicare at 65 or you may be penalized. But no one really covered what that may meant. There's a lot to that may, and yes, you might be penalized if you don't meet Medicare rules. But many of you do meet Medicare rules, so you can delay Medicare past 65. So please do your due diligence, understand what's ultimately right and best for you, and make your right Medicare decision. Now, in the comments below, I will share extra resources to help you all easily navigate Medicare to, again, do what's ultimately right and best for you. And we look forward to helping you here at the Medicare Coach. And we are a non-agent, non-insurance company, non-government system helping our clients easily navigate Medicare, just like how an accountant or a CPA helps us navigate taxes. So we look forward to helping you here at the Medicare Coach to easily help protect your retirement savings and have the best healthcare possible. Click the link below to get more information as to how we can help you.